Good day, everyone. You're welcome to my YouTube channel, Everything Medical. On today's video, I'll be treating the anatomy of the arm. The arm is an important region in the upper limb. It is an important region in the upper limb, which is located vertically between the shoulder and the elbow. The long bone of the arm, which is the humerus, is located in the arm, which forms an articulation through its proximal end with the scapula to form the shoulder joint. Now, it forms as well an articulation through its distal end, that is the lower end, with the elbow to form the elbow joint. There are numerous joints in the elbow region. Those joints are cumulatively called the elbow cubital complex, which is being contributed distally by the lower end of the humerus. Those joints include the superior radioulnar joint, the humeroradial joint, and the humeroulnar joint. Those are the joints that forms the elbow cubital complex that is being contributed by the distal end of the humerus. The primary neurovascular bundles of the arm are being protected by the arm because of the vital functions they play. What are those vessels or structures that serves a function in the arm? They include the blood vessels, which is the arteries and veins, and as well the nerves. So that is all about the concept of the arm. So we have the introduction. I've said earlier that the arm is a vertical region that is located in the upper limb that spans between the shoulder, that is proximally, and the elbow distally. And it lodges the long bone of the arm, that is the humerus. So that is the concept of the arm. The next we'll be discussing is the compartment of the arm. The compartments. The compartment of the arm. The arm is enclosed by a deep fascia sleeve. It is enclosed by a deep fascia which acts like a sleeve. Extension of this deep fascia sleeve are the two intermuscular septa. We have the medial and lateral intermuscular septum, because they are the extension of those deep fascia sleeve. There are two intermuscular septa that helps in partitioning the arm in compartments. We have the medial intermuscular septum and the lateral intermuscular septum. When we say septa, it is plural. When we say septum, it is singular. Now, the medial intermuscular septum extends inward from the deep fascia sleeve to be attached on the medial supracondylar ridge of the humerus, while the lateral intermuscular septum extends inward from the deep fascia sleeve to be attached on the lateral supracondylar ridge of the humerus. This fascia and the deep fascia sleeve helps to partition the arm into two compartments, where we have the anterior and the lateral, where we have the posterior and anterior compartments. Because the arm is being divided into two compartments by the deep fascia sleeve and the septa. We have the anterior and posterior compartment of the arm. So the arm is divided into two compartments by the deep fascia sleeve and the septa. We have the anterior compartment, and the posterior compartment. This is the diagram that depicts the structures of the arm. This is the transverse section of the arm. Here is the lateral intermuscular septum. The lateral intermuscular septum, while here is the medial intermuscular septum. As you can see, there are the intermuscular septa that partition the what? The arm alongside with the what? With the deep facial sleeve. Because this line that is being drawn with the green marker depicts the deep facial sleeve. So it is the deep fascia. Here is the deep what? Fascia of the arm. Deep fascia of the arm. While here is the superficial fascia. Superficial fascia. Why this is the skin. This is how they go. Recall that the compartment of the arm have their own muscles, vessels, and nerves. But that does not mean that there is no any interconnection of structures between the anterior and posterior compartment, because the radial nerve and the radial collateral artery pierces the lateral intermuscular septum to enter the anterior compartment, while the ulnar nerve and the ulnar collateral artery pierces the medial intermuscular septum to enter the posterior compartment. To tell you that these structures either enter the anterior compartment or the posterior compartment in respect to the compartment they are being located. So this is how it goes. So we have the anterior compartment and the posterior compartment. So we are going to be looking onto the anterior compartment of the arm. So this is the arm, transverse section of the arm. Transverse section of arm. That's the diagram. Okay, let's look into the anterior compartment of the arm. The anterior compartment. The anterior compartment is as well the flexor compartment of the arm. Yes, it is the flexor compartment of the arm. The anterior compartment has the following content. That is the content of the anterior compartment. The content. We have number 1, the artery. Number 2, the muscles. The muscles. Number 3, we have the nerves. So, in the artery, what is the main artery of the anterior compartment of the arm? It is the brachial artery. We have the brachial artery. The brachial artery. Muscles. What are those muscles that form the anterior compartment of the arm? We have number 1 is the biceps brachii. The biceps brachii. Number 2 is the Coracobrachialis. The Coracobrachialis. The Coracobrachialis. Coracobrachialis. While the 3 is the brachialis muscle. The brachialis muscle. Then our number 3 is the nerve. What is the major nerve of the anterior compartment of the arm? It is the musculocutaneous nerve. The musculocutaneous nerve, because it has a muscular branch, a cutaneous branch, and the articular branch. It is majorly the muscular branch of the musculocutaneous nerve that innervates the muscles in the anterior compartment of the what? Of the arm. So we have the musculocutaneous nerve. But that does not mean that there are not other structures that passes along the anterior compartment of the arm. We have other structures such as the radial nerve, the median nerve, and the ulnar nerve. Other structures include other structures include the median nerve, the basilic vein, the ulnar nerve, and as well radial nerve. Why is radial nerve here? Because the lateral one-third of the brachialis muscle is being innervated by the radial nerve, while the medial two-third is innervated by the musculocutaneous nerve. So here, let's depict it on the diagram, because here is the anterior compartment, while here is the posterior compartment. So we have the cephalic vein, we have our chief nerve, which is the musculocutaneous nerve. Musculocutaneous nerve. We have our chief artery, which is the brachial artery. Brachial artery. Then we have our vein, which is the basilic vein. The basilic vein. Now, we have our nerve, which is the median nerve. Median nerve. Okay, our first muscle is the biceps brachii. The biceps brachii. The biceps brachii. We have the next one, which is the brachialis muscle. The brachialis muscle. Brachialis muscle. The last one is the Coracobrachialis. The Coracobrachialis. So we are going to be discussing these musculatures in the anterior compartment of the arm according to the muscles. We'll be discussing it according to the muscles. Yes. So let's go ahead as we discuss it according to the musculatures based on the origin, the insertion, the nerve supply, and the action, and as well the clinical texting. The first muscle we'll be discussing is the biceps brachii. The biceps brachii. The biceps brachii. We'll be discussing it based on the following headings. One is the origin. Two is the insertion. Three is the nerve supply. Four is the action. While five is the clinical texting. The clinical testing. Okay, let's start with the origin. The origin. Number one, the origin. The bicep brachii has two heads in the origin. It has two heads, the long head and the short head. The long head of the bicep brachii and two is the short head. Okay, the long head of the bicep brachii is originated from the supraglenoid tubercle of the scapula. That is within the capsule of the shoulder joint, because the tendon of the long head of the bicep brachii runs or spans superiorly above the head of the radius from the intertubercular sulcus of the humerus. So the long head is originated from the supraglenoid tubercle of the scapula within the capsule of the shoulder joint, while the short head is originated alongside with the Coracobrachialis at the tip of the coracoid process of the scapula. That is where they have been originated. Now let's go to the insertion. The insertion. The bicep brachii is inserted, number one, at the posterior aspect of the radial tuberosity by its tendon. It is inserted at the posterior aspect of the radial tuberosity by its tendon. It is as well being inserted at the deep fascia on the medial aspect of the forearm by its aponeurosis. What is the aponeurosis of the bicep brachii? It is the basipital aponeurosis. Recall that the head of the bicep brachii joins together at the distal third of the arm to form the belly, where it ends on the tendon. What is this belly? It is the basipital aponeurosis. Recall that the basipital aponeurosis protects some of the overlying structures in the arm, which is the brachial artery and the median nerve. Okay, that is how it goes. Now we'll go to the action. What is the action of the bicep brachii? The action. The action. The action. Number one action is that it is the strong spinator of the forearm. Number one is it is the strong spinator of the forearm. Number two, it is a strong or it is a powerful flexor of the forearm when the elbow is extended. The number three action of the bicep brachii is that it is a weak flexor of the shoulder joint. Yes, it is a weak flexor of the shoulder joint. So we have listed the action. Number one is that I said that it is a strong supinator of the forearm. Number two, it is a powerful flexor of the forearm when the elbow is extended. Number three is that it is a weak flexor of the shoulder joint. So we have number one, number two, and number three. So those are the actions of the bicep brachii. So the number four is the nerve supply. The nerve supply. What is the nerve supply of the bicep brachii? It is the musculocutaneous nerve. That is the muscular branch of the musculocutaneous nerve. Because that the musculocutaneous nerve has the C5, C6, and C7 arising from the brachial plexus. Yes. Okay. Now, the last one is the clinical testing. The number five, the clinical testing. What is the clinical testing of the bicep brachii? Recall that the clinician always asks the patient, to flex the elbow joint. to flex the elbow joint in resistance to the forearm supination. When this is being done, there will be a prominent bulging on the anterior aspect of the arm. So the muscle is like this. You get, you flex the elbow in contrast to the resistance of the forearm when supinated. There will be a prominent bulging on the anterior aspect of the arm. That is the clinical testing of the biceps brachii. You get. So up the next we'll be discussing is the coracobrachialis muscle. So the coracobrachialis. The coracobrachialis. The coracobrachialis. The coracobrachialis. We'll be discussing coracobrachialis based on these headings: the origin, the insertion, nerve supply, and what action. First is the origin. What is the origin of the coracobrachialis? Recall that the coracobrachialis is originated from the tip of the coracoid process of the scapula. That is alongside with the short head of the biceps brachii. That is the origin. The two is the insertion. The coracobrachialis is inserted on the medial or the mid shaft of the medial border of the shaft of the humerus. It is inserted at the middle of the mid shaft of the medial border of the shaft of the humerus. That is where it is inserted. So it is inserted on the middle of the medial border of the shaft of the humerus, or the mid shaft of the medial border of the shaft of the humerus. That is where it is inserted. Recall that the insertion of the coracobrachialis is a landmark. Yes, because there are so many anatomical events that occurs at the level of the insertion of the coracobrachialis. Number one is that the circular shaft of the humerus becomes triangular below the level of the insertion of the coracobrachialis. Number one anatomical event. I repeat, the circular shaft of the humerus becomes triangular below that level. Number two, the basilic vein pierces the deep fascia at that level. Number three, the nutrient artery enters the humerus at that level. Number four, the brachial artery passes on the medial side of the arm to the anterior aspect. Then number four, the medial nerve crosses the brachial artery from the lateral to the medial aspect at that level. Then number five, the radial nerve pierces the medial, the lateral intermuscular septum to enter the anterior compartment of the arm. Number six, the ulnar nerve pierces the medial intermuscular septum to enter the posterior compartment of the arm. Then number six, the medial and lateral cutaneous nerve of the arm pierces the deep fascia, of the forearm, pierces the deep fascia at that level. So to tell you that there are so many anatomical events that happens at the level of the insertion of the coracobrachialis. So it is a landmark. It is a landmark. It is an important landmark in the arm because of numerous anatomical events that takes place at that level. So the next we'll be discussing is the nerve supply. The nerve supply. The coracobrachialis is innervated by the musculocutaneous nerve. Recall that It is the branch of the musculocutaneous nerve that innervates the three muscles on the anterior compartment of the arm. Okay, the action. The action. What is the action of the Coracobrachialis? It is a weak flexor and adductor of the arm. Yeah, very, very important. And that was how you. It is a weak flexor and adductor of the arm. That is the action of the Coracobrachialis. Okay, the next muscle we'll be discussing is the brachialis muscle. Yes, the brachialis muscle. The brachialis muscle. The brachialis. Okay, we'll be discussing brachialis on the origin, the insertion, the nerve supply, and the action. So you can see here, this is the brachialis muscle. Yes, the brachialis muscle. What is the origin of the brachialis muscle? The brachialis muscle is originated on the anterior or in front of the lower half of the shaft of the humerus. It is originated in the anterior aspect or in front of the lower half of the shaft of the humerus. And as well, that is just the origin. It does not have two heads of origin. It has only one head of origin. So it is originated on the anterior or in front of the lower half of the shaft of the humerus. Then superiorly to the origin of the brachialis embraces the insertion of the deltoid muscle. Yes, that was how it. Because superiorly to the origin of the brachialis muscle at the anterior aspect of the lower half of the shaft of the humerus embraces the insertion of the deltoid muscle. That was how it. Next thing we'll be discussing is the insertion. Yes, the insertion of the brachialis muscle. The brachialis muscle is inserted on the anterior surface of the chronoid process of the ulna and as well the ulnar tuberosity. Yes, that is the insertion of the brachialis muscle. It is inserted on the anterior surface of the chronoid process of the ulna and the ulnar tuberosity. Okay, the nerve supply. The brachialis muscle is supplied by two nerves. That means it has a dual innervation. It's supplied by two nerves. To tell you that it has a what? A dual innervation. What are those nerves? The medial two-thirds of the brachialis muscle is innervated by the musculocutaneous nerve, while the lateral one-third is innervated by the radial nerve. So that is how it. Okay. The action. The brachialis muscle is known as an untiring strong flexor of the elbow joint. It is the untiring strong flexor of the elbow joint. Hence, it is known as the workhorse of the elbow joint. So that is why it is called the workhorse of the elbow joint, because it is the untiring strong flexor of the what? Elbow joint. So that is all about the musculatures of the anterior compartment of the arm. So what we'll be looking on to, or up the next we'll be looking on to, is the posterior compartment of the arm. The posterior compartment of the arm. Yes, we will be discussing the posterior compartment of the arm. The posterior compartment of the arm. What are those contents of the posterior compartment of the arm? Contents. We will have the muscle, the artery, the nerve. The muscle in the posterior compartment of the arm is no other muscle than the triceps brachii. The triceps brachii. Then the artery is actually the profundi brachial artery. Recall that the profundi brachial artery is the largest branch of the brachial artery that arises from the posterolateral aspect of the brachial artery, just below the teres major. It accompanies the radial nerve at the radial groove or the spiral groove located at the upper part of the posterior surface of the humerus. It terminates to give two branches, the anterior and descending branch, that contribute to the formation of the arterial anastomosis around the elbow. So we have the profundi brachial artery. Something profundi means deep. Profundi means deep. So the nerve is the radial nerve. Recall that the radial nerve is the largest branch of the brachial plexus that the profundi brachial artery accompanies on the spiral groove or the oblique groove located on the upper part of the posterior surface of the humerus. The radial nerve. So we go to the triceps brachii, that is the muscle. The triceps brachii. We will discuss the triceps brachii in the following headings. Number one is the origin. The origin. What is the origin of the triceps brachii? Recall that the triceps brachii has three heads. The long head, the lateral head, and the medial head. So we have the lateral head, we have the medial head. Yes. So the triceps brachii has the long head, the lateral head, and the medial head. That is why it's triceps. It has three heads of origin. Now, the long head is originated from the infraglenoid tubercle of the scapula. That is why it's originated. That is the long head. The lateral head is originated from the oblique ridge above the spiral groove on the upper part of the posterior surface of the humerus. So the lateral head of the triceps brachii is originated from the oblique ridge above the spiral groove on the upper part of the posterior surface of the what? The humerus. While the medial head is originated on the posterior surface of the lower half of the shaft of the humerus, below the spiral groove. That is the origin of the medial head, from the posterior surface of the lower half of the humerus, below the spiral groove. That is the origin of the medial head. Okay, now we delve to the insertion. Insertion. Where is the insertion of the triceps brachii? Because these three heads forms the common tendon. You get? The insertion of the triceps brachii forms the common tendon. You get? Where are they being inserted? They are being inserted on the posterior part of the superior surface of the olecranon process of the ulna. That is the insertion of the triceps brachii from the posterior part of the superior surface of the olecranon process of the ulna. That is the insertion of the triceps brachii through its common tendon. Through its common tendon. Yes. Okay. So the next to be discussing is the action. The action. What is the action of the triceps brachii? The triceps brachii performs, or it is the powerful extension of the elbow joint. It is the powerful extension of the elbow joint. And as well, the lateral head of the triceps brachii supports the head of the humerus during hyperabduction of the arm. Yes. The long head per se, not the lateral head. The long head supports the head of the humerus during hyperabduction of the arm. While the major work of the triceps brachii, that is the action, is the powerful extension of the elbow joint. or powerful extension of the what? Elbow joint. That is the action. Okay, now here, this is the lateral head. The lateral head of tricep brachii. This is the medial head. The long head. The long head. Why here is the medial head. So the long head of the tricep, the lateral head of the tricep, the long head of the tricep, and the medial head of the tricep. Here is the profunder brachial artery. Profunder brachial artery. Okay, the profunder brachial artery. Why this is the radial nerve. The radial nerve. Here becomes the ulnar nerve. Ulnar nerve. Recall that the ulnar nerve and the ulnar collateral artery are the associated structures that could be the contents of the posterior compartment of the arm, because it is not only the radial nerve and the profunder brachial artery. So the ulnar nerve and the ulnar collateral arteries are as well one of those contents of the posterior compartment of the arm. Yes. Okay. So we go to the nerve supply. The nerve supply. The nerve supply. Okay. The nerve supply of the tricep brachii is according to the three head of the tricep brachii. The long head of the tricep brachii is supplied by the radial nerve in the axilla. Yes, that is the nerve to long head is the radial nerve in the axilla. While the nerve supply to the lateral head is by the radial nerve in the spiral groove or the oblique groove of the upper part of the posterior surface of the humerus. The nerve supply to the medial head is by the radial nerve in the spiral groove as well. So that is how it goes. So the long head is the radial nerve in the axilla, while the lateral and the medial head is the radial nerve in the spiral groove of the humerus, posterior surface of the humerus. Okay, so that is how it goes. We have discussed the origin, the insertion, the action, and the nerve supply. So the next thing is the clinical correlation. The clinical correlation. Clinical correlation. What are those clinical correlations that is associated with the arm, both the posterior and anterior compartment? Okay, the first thing is injury to the musculocutaneous nerve. Recall that the musculocutaneous nerve has three branches. That is the muscular branch, the cutaneous branch, and the articular branch. Okay, because the muscular branch of the musculocutaneous nerve supplies to the three muscles in the anterior compartment of the arm, while its cutaneous branch supplies to the skin on the lateral aspect of the forearm. That is the lateral cutaneous nerve of the forearm, while its articular branch supplies to the elbow joint and as well the brachialis. You get, so it has three branches. So injury to the musculocutaneous nerve will lead to loss of flexion and supination of the arm. Number two, it will lead to what? Loss of bicep tendon reflex. Number three, it will lead to what? Loss of sensation on the skin at the lateral aspect of the forearm. So to tell you that lesion to the musculocutaneous nerve will lead to these things I just mentioned. It will lead to what? Loss of flexion and supination of the arm, loss of bicep tendon reflex. It will as well lead to loss of sensation on the skin at the lateral aspect of the forearm. So those are the clinical correlation that could be implicated when there is a lesion to the musculocutaneous nerve. Do you get? So that is how it goes. So the next clinical correlation is injury to the radial nerve. But injury to the radial nerve does not lead to loss of extension of the elbow and tricep reflex, because the long head of the tricep brachii is innervated by the radial nerve in the axilla. So you could see that it will not lead to complete loss of extension of the elbow and tricep reflex. You get? Because the long head is innervated by the radial nerve in the axilla. So it could only cause lesion to the nerves of the lateral head and the medial head, because the injury was in the spiral groove or the oblique groove of the humerus. So that is all about the anatomy of the arm. We have done justice in this topic. I believe you understood it properly. So endeavor to watch the video to the end, share it across, hit the subscribe button, and anticipate for more videos on anatomy. Thank you so much for watching.